exempt him from his Master's Comprehensive exam. We'll be able to log on and see his exam performance. So let's transition over then to the respiratory system. I have just barely been able to resurface and haven't looked at the site. Marco said he was looking at some of the exam question summaries. We'll get an assessment of that and begin working on it. It's like we're nurturing this embryo on WebCT, and we're all the little different placental cotyledons feeding into it. So it's growing into something. Hopefully it's going to be not too abnormally mutated and deformed. But let's see if we can build some lungs for it, starting today. And get the tip on here. So, I just need to adjust the input up here. One more. And here we are. So we begin with Lecture 19 then. And we should be able to get through the majority of it. Marco, are you preparing for Lecture 20 for Friday? So we're getting back on track. We should be able to get whatever we don't complete from Lecture 19 today taped and posted. I'm still just kind of on hands and knees crawling, growing back into a full-fledged teacher for you in the class, but I'll be back there next week and getting things going. We've got a bunch of fancy new stuff, and I haven't been able to touch it yet in a month or so, so I'm anxious to get in there and begin working with it. So we're all familiar with the respiratory system. We know we're going to be following, or at least taking a look at the completion of the development of the nasal cavity and the oral cavity. Still not a tremendous focus on it, but they're part of the respiratory digestive system interfaces, so we have to view those. We have to follow them into the throat region, into the neck region, where we know that we have the larynx, which is the relationship, again, the final splitting of digestive and respiratory system, and then proceed into that pleural cavity that we followed in development and fit the lungs in there. We already talked about the lungs growing into the balloon type of a thing when we were talking about the peritoneal canal. So now we're playing with that part. We're going to convert it to the pleural compartment that contains the lungs or surrounds the lungs. So we are, again, back at about the 4th week. So week 2, 2 layers. Week 3, 3 layers. Week 4, we're kicked into gear and we're starting to produce the organ systems. So we're kicking in organogenesis big time now. And actually this lecture begins our formal evaluation of the development of each organ system. So we're now locked into organogenesis. So we've done the overall body shaping and everything, and focused a bit on cytogenesis, the development of the cell, lineages, histogenesis, the development of tissues. We'll even focus on that more now. And then as tissues collect together, we form organs and then organ systems. So we're really gearing up to follow through with that now. So we will be looking at more and more histology sections, actual stained sections, and training you to recognize cells. You know, the blue dot, everywhere you see a blue dot is a nucleus. There'll be these types of things. So we're building many different skills that you may or may not have developed. If you have taken histology, what's the course we have? Histology cytology, right? Yeah. If you've taken the histology cytology course that we teach, this will be a breeze. If you haven't, this will show you a bit of what you would be doing in that class of studying cells, how they function, and the tissues within which they reside and how they function collectively. So this is a collection of skills that can be utilized in other courses, or they really should be basic skills for any biology major. We should be able to recognize cells and tissues and even be able to say, oh, that's lung or that's kidney. just from a histological slide. So we're in that fourth week. There's going to be the initial structure appear, and we're now beginning to focus on the floor of this portion of the foregut, the pharynx, that early pharynx. Excuse me. And these are, we saw the thyroid, the thyroglossal duct. So that was a ventral floor, unpaired structure that came out. Now we'll see the lung bud, not lung bud, the laryngotracheal bud will initiate as a laryngotracheal groove and begin to grow out. So it's an out-pocketing as we see. So it is caudal to the fourth pharyngeal pouch. So remember, there were 4 prominent ones, 5 and 6 were vestigial, and we'll just kind of see them popping up as we go along. So we remind ourselves, endodermal origin is going to be the epithelium, the glands of the larynx, the trachea, the bronchi, the lungs. So we'll follow the contribution of the endoderm to these structures throughout. In addition, just adjusting my mouse here. In addition, the mesoderm, this is the splanchnic mesoderm, is going to contribute connective tissue, smooth muscle, and cartilage. However, we remind ourselves that these are pouch areas, these are the arch areas, so we're going to have mesenchyme of neurocrest origin here as well. So we're going to see this mixture of splanchnic mesoderm and mesenchyme, and we're distinguishing those on the basic origin. So here is figure 11.1 from the text. So first we're going to see a lateral view. It's a drawing, an illustration of the 4-week-old embryo, and we very quickly recognize the heart bulge, the nasofrontal prominence up here, and the optic placode. The otic. No, this is the optic placode. And we see the maxillary prominence, and then the arches 1, 2, 3, and 4, and we recognize as well that each of these is going to have a pouch on the inside. So we're envisioning these folds as if they're fingers in front of us, and on the surface, the whole thing is the arch, pushing in from the inside, pushing out from the inside of each of these is the pouch, and then the in between the fingers is what is it? Somebody help me. The groove. Thank you very much. Yeah, that groove in between them is the groove. Okay, I'm only firing on 7 of my 8 cylinders, and 2 of those are misfiring, so hang in there with me. Should be able to recover fully within about 10 years. Okay, so now in panel B, what we're looking at is a midline cut, so mid-sagittal cut, and now we're looking into the pouches. And so we're just seeing these openings, these cleavage type areas into the pouches. So we're standing inside the primordial pharynx looking, and there are these little pouches there. We could stick our hand into each of the pouches as if they were a purse. And then finally, on the panel C, we're looking at, from a dorsal view, onto the floor of this area. I want to point out a couple of things. They show the site of the oropharyngeal membrane, but they do not have it painted blue. We know this should be blue because when we look in panel C, they show it blue over here. This is the surface ectoderm that came into this area. So right at the back of the tongue, up to the uvula, is where that membrane originally was located. So all of the oral epithelium in front of that is of ectodermal origin. So this indeed should be blue in this area. Excuse me. And then we follow the pouches down, the arches and the pouches down to their terminal point, and this is where we see the laryngotracheal diverticulum just beginning to bulge out. So this is where the site of the laryngotracheal groove would be on the inside. When we flip over to the back side, and then we're looking down into this area, and we see that little groove right here. So in front of that is the hypobranchial eminence. This becomes important for the formation of the cartilage, some of the cartilage in this area. And then in front of that is the foramen cecum, where the thyroglossal duct had emerged. So we try to keep our orientation. We're looking at these views repeatedly and picking on new things as we go along, then finally we'll move away from it all and leave it behind. This is one of my favorite views for envisioning the development at this point, or a week later, the 5th week, because it is showing if they mirror, not a mirror, like a window or see-through type of a vision, a ghost view, if you will, of just the endodermal lining of these structures, all of the foregut, midgut, hindgut at 5 weeks. But it also is showing the liver buds developing in this area to help us realize where abdomen would be and where thorax would be. So this obviously is the heart bulge here. So here's arch 1, 2, 3, and then 4. So just after 4, between 4 and 6, is where the laryngotracheal groove would have been, and the bud is now grown to extend so that we see a trachea and the bronchial buds. So the 2 bronchial buds are going to begin to form and push off to the sides. And we can see it's obviously going to be taking place at first behind the heart bulge, but eventually the thorax is going to grow in length and in overall capacity, and the heart's going to fall into place, and then the lungs are going to take position on either side. But the other thing we want to view on this is and we will see it again, are the pouches for each, relative to each of the arches, and this general arrangement of things where the oral cavity is going to complete its formation up here, the oral pharynx, then the laryngopharynx will form and ultimately meet with the larynx in this area of the foregut to have its junction with the trachea, and then the esophagus continuing down posteriorly. So we'll see that again, and what's important, of course, is that we can now come to this illustration and realize that it's going to come back and visit us repeatedly, so close to Halloween. I want to say come back and haunt us, so we're looking at ghost views and things are going to come back to haunt us, so we're getting geared up for Halloween. So we see basically the same thing, stippling here. This is obviously a little bit earlier than the 5th week because we don't have the trachea and the bronchial buds formed. So you can see that even between this view, somewhere in the 4th week, maybe early 5th, and then this view in the 5th week, that there is an elongation of the foregut with that tracheal bud, tracheal attachment descending a little bit into the body, upper body or trunk region of the organism. We know it's going to end up in the throat region, so there's still a lot of changes that have to take place near this heart bulge for everything to drop and the neck to form and things to stretch out. So there's a tremendous amount of remolding that has to occur in this area. But quickly we can label things. 14 is obviously the oropharyngeal membrane. We could call it the oropharyngeal membrane. It is also, we could, I guess, call it the stomadeum. But it really is pointing at a structure, so I would want to call it the oropharyngeal membrane. Remember, the stomadeum was a space, right? So the wording of the question is what is going to key you in to the response. Identify the space around the pointer, that would be the stomadeum. Identify the structure at the tip of the arrow, that would be the oropharyngeal membrane. And then the stippling area is showing the gut tube. So the foregut basically is going to come from the area down here all the way forward, And let's not get too strict about the delineation of it right now, but we can see that number 1 would be the pharynx. Number 2 is going to be the laryngotracheal bud. Number 4 is going to be the stomach, and then we won't worry about any of the rest until they come back to haunt us around Halloween time. So let's shoot immediately then to a mid-sagittal view of the adult structures and see what we're going to be developing. So the tracheo-esophageal junction we know is here in the neck region, around what's the Adam's apple as we call it. And so in that general area would be where the fourth pouch had ended. So all the other fourth arch, all the other arches are going to contribute to the structures that we see above this. And when we come here to the uvula, the tip of the soft palate, we see the hard palate here, so we now know how that forms. So basically at the tip of the soft palate, the uvula, we kind of go straight up. This is obviously the opening into the auditory canal. So we just go straight up from there and draw a line straight down to the base of the tongue, and that's where the oropharyngeal membrane would have been located. So the space in front of it was the stomodeum, and the stomodeum was invaded basically by the arches coming around and meeting the maxillary prominence and the frontonasal prominence and all that stuff, and just closed off this entire area. So those all coming around generated all these structures that we see here. So the epithelium lining these structures originated from the surface ectoderm. So the nasopharynx is going to be back here. The the oropharynx is going to be just in back of the oral cavity, and then the laryngopharynx is the portion down here, obviously near the larynx. So all of these areas are going to be lined by endodermal origin epithelium. And I do need to go back and correct myself up here. We talked about the type of epithelium lining, just that entrance into the nasal cavity, the vestibule. That's where we have the hair follicles. So there actually is a line in this area up here that separates surface ectoderm from the remainder. My apologies there. So this is all endodermal origin that we see in this area, but definitely the oral cavity from this level of the soft palate up forward right to the lips is ectodermal origin. Sorry about the confusion there. So we are in this area then. We see the eustachian tube that shoots off out. So it was one of the pouches that just shoots out to the middle ear cavity. And then this remains in here as the pharynx. And then what we're going to do is begin to focus down here on the development of the larynx, the trachea, and of course the two bronchi. And then Friday's lecture will focus on the final development of the lung tissue. So tissues from which lung buds are formed include, so we know there has to be mesoderm and we know there has to be endoderm. So it's either A or D. And somatic reminds us of body. Splanchnic reminds us of viscera or organs. So obviously it's the splanchnic, mesoderm, and the endoderm, and that was on a previous slide. So the laryngotracheal groove is going to expand and form the laryngotracheal diverticulum, and then it'll be located ventral to the caudal foregut, so the more caudal portion of the foregut, and we're going to be in front of it, and that general area, the caudal foregut, is the end of the pharynx, where it would have joined with the esophagus. So in other words, the laryngopharynx. So the laryngotracheal diverticulum expands to form the lung bud ultimately, and we saw the trachea and the bronchial buds as part of that. So the lung bud is going to continue to expand, but it remains continuous. There's a septum that forms to separate the gastrointestinal pharyngeal tube, that future esophagus is going to be dorsal to it. From the respiratory tube, the future larynx is going to be in front of or ventral to it. And this is very important, and we'll follow through in these series of figures. Again, whenever you have this occurrence of a remolding of an original structure to where you have to have these bulges form that come together and meet, if there's a failure to fuse, then there's a defect. So we saw the failure, the abnormalities or the developmental defects when there's a failure of fusion of any of the arches or the bulges and things like that in the face and oral cavity region. So obviously, if there is a failure for this to occur and fusion to complete, then we're going to have a persistent opening between the GI system and the respiratory system, and that's obviously not a good thing to have. So here in panel A, we are seeing the 4th week. We'll proceed through the 5th week and onward until we see that there's a complete separation of the GI tract, well, only the appropriate persistent opening, but where we need it, this closure between the future esophagus and the larynx. So in panel D, what we see is the different linings. So let's go back to A for just a moment. We can strip away the mesoderm and we have just the endoderm. So the endoderm contributes to the lining cells. The surface cells are called an epithelium. Now we'll see that epithelia will, or the surface cells, endodermal cells, will form a cord of cells that will push into the mesoderm nearby. So it's normal for our developing cells to become invasive and move to other locations. So this is a property we see in cancerous cells or even non-cancerous tumors. They will migrate, invade, infiltrate, set up residence, and begin to grow. So there's something going on where we're triggering this developmental process that shouldn't be occurring in cells at that stage of the development of the organism. At this stage, it's normal. We need to infiltrate, grow in, develop into glands, and then produce a duct that opens onto the surface. So it's the same type of a thing. Start with a cord of cells that have to open up and become patent to become functional. So what was the first time that we saw this occur? What developed the first time we ever saw this? An invasion of a solid cord of cells that opened up into a patent structure. Anybody know? Note an idea in the class? The notochord. Remember, the notochord did this same thing. So it was a solid cord of cells pushed out and then became patent and then moved on to become other things. So it's not an uncommon thing in the developing organism for this to occur. But it's only supposed to happen in these windows and complete what it's doing, and then the cells should forget that they were ever able to do that. So there's something there related to the invasive nature of tumors. So we now see in panel D, the pink is the mesoderm, and the yellow is the endodermal lining. So there's just these little bulges, the tracheoesophageal folds, and we see the primordium of the laryngotracheal tube anteriorly or in the ventral plane, and the pharynx posteriorly. So now we can see in panel B and C similar views as in A, but we're advancing in weeks, and we have the same horizontal planes of section. And what we see in panel C is that there will be the primordial laryngeal inlet here, so it will be an actual open tube that is developing here. So it's not the solid cord of cells that we are describing with the formation of the glands and the notochord and things like that. We start with a groove, and so as it deepens, the patency of this persists, so it's actually a tubular type of structure that is growing and developing. So when we look in panel E, what we see are the folds are approximated, made contact, fused together, and we get a tracheo-esophageal septum, and then this will be completed, and there is no opening at this point between the esophagus and the laryngotracheal tube. So what we see is that this elongated slit, if you will, that originated when we had the groove has now closed off to become just a narrow opening, the one that's supposed to be there, the laryngotracheal tube. So it's possible for some patency to persist, and that is not a normal occurrence. So what we have seen then is that this general area in here has undergone a great deal of differentiation so that we are left with only this opening between the laryngopharynx and the trachea, larynx, excuse me, and the esophagus continuing down posteriorly. So if there was a problem, there might be some persistent opening that would have occurred below that, and it would be abnormal and would have to be detected and surgically corrected as soon as possible. So now we have to follow the remainder of the development to continue to produce the very complex musculocartilaginous larynx and keep in view the esophagus developing posterior to it. So when, where, and in which form does the primordium of the respiratory system first appear? So we saw it in the 4-week embryo, and it appeared first as a groove, so that it was this elongated groove that grows outward, and we then have to close it off to narrow it up. And then at that point, when it is first forming as the groove, it's called the laryngotracheal groove. It's going to give rise to the primordium of the larynx and the trachea. So from which branchial arches does the larynx develop? So it's 4, 5, and 6. So the last 3 of them contribute to this. So the cartilages and the muscles of the larynx develop from the mesenchyme of the 4th, 5th, and 6th pharyngeal arches. When we hear this term mesenchyme with arches, what do we think of? Neural crest origin, right? So neural crest origin for the mesenchyme that contributes to the connective tissue and musculature, just as any other mesoderm does, but this is specialized mesoderm from the mesenchyme. So there's some splanchnic mesoderm in this area and special mesenchyme of neural crest origin. So especially at this area, we're beginning to transition and see some of the specialized mesenchyme and somatic mesoderm begin to contribute to the formation of the structures. And then eventually it's just going to be some, not somatic, splanchnic mesoderm that's going to contribute to the connective tissue and smooth muscle of the digestive and respiratory systems from here on out. So the adult structures will be the 9 cartilages, and we'll continue to see these on images of the adult larynx. There's 9 of them. They are a hyaline type of a cartilage, and then there are the vocal folds, both a true and a false, that have to develop. So we've seen those. We'll see them again and again, and we'll relate back to the developing embryonic structures. So a lot of remolding in this area. We start with a groove that becomes a tube, and now we're going to have to remold it into the mature, let's say, form of it, the larynx. Again, any epithelial lining is going to be of endodermal origin, as we found lining the inside of the laryngotracheal tube. The cartilages will come from the 4th and 6th pharyngeal arches, as we saw. Immediately, we think of mesenchyme, neural crest origin. There will be these arytenoid swellings that form cranially within the tube. So what we're going to find are these funny named cartilages. So I don't know what an arytena is, but something looked like that, and it's called arytenoid. We're going to see these are cartilages that are kind of shaped like your hand if you close all your fingers except your thumb and your second digit, and they're just going to have this base that sits on something, and then they're going to be able to move back and forth. They're going to have muscles attached to them. So obviously they're going to be very important in connecting to our true vocal, to the vocal cord, and be able to tense or relax it. So these arytenoid cartilages are going to be related to that. And I know what arytenoid means. It means to have wings. So those are the wings that it has. So this will lead ultimately then to this complex formation of bone, membrane, cartilage, and musculature, and everything else that needs to be there, epithelial lining, the glands to keep it moistened, the nerves to come in and sense the positioning and everything else that's going on, and to innervate the musculature, and all the autonomics to come in and innervate the glandular and vascular components as well. But here we've stripped away everything. We have just the cartilage, the ligaments, the membranes, and the hyoid bone. So we already looked at the formation of the hyoid bone, the lesser cornua or horn, the greater cornua or horn, and then the body formed from two parts. So we've seen that already. From this anterior view, we know it's anterior because here's the laryngeal prominence, or the Adam's apple. And we look behind, and there's the epiglottis. So the epiglottis is positioned posteriorly, as we see in this lateral view with a midline, mid-sagittal section through the area. So we see the epiglottis here lying posterior to the body of the hyoid bone. So it obviously is positioned here so that when we are going to use this area as our digestive system, we pull it down and close over the opening in this area. We'll take a look at that opening. It's called the glottis. So the epiglottis is on top of the glottis, which is the opening. So the glottis is an opening. The epiglottis is the structure that comes down on top of it and closes it off, so that when we use this as a digestive organ system, everything goes back to the esophagus and doesn't go into the respiratory tract. So we're already seeing some of the cartilages from this midline view, and we'll come back and visit those in a moment. Let's go back to the cartilages from the anterior view. The main one forming these two shields is, of course, the thyroid cartilage. So we can palpate that on ourselves, and you squeeze it, and it changes your voice. And then just below that is the cricoid cartilage. So you should be able to palpate your thyroid cartilage, find the laryngeal prominence, and then if you just bring your finger inferiorly from there, you should be able to feel a little indentation, and that would be this spot where the cricothyroid ligament will be. So immediately below that then is going to be the cricoid. So you should be able to grab the cricoid, move it back and forth. And then just after that is going to be the trachea going right down into the thoracic cavity. So there's a couple of things that are very important in studying developmental biology from the anatomical perspective and studying anatomy. You should be able to palpate structures and know where things are located. So the thyroid gland, we know, should be right in this area, and you shouldn't really be able to palpate it. You might feel it kind of slip in and out underneath your thumb, but if you actually can feel your thyroid gland quite prominently in this area, you need to go see a physician, right? Or if you can visualize it on the surface. So we know the thyroid gland is just in this area because the thyroglossal duct came right down here in front of the hyoid bone, right down through here, and spread out into the two lobes of the thyroid gland. So now from the inside, so if you stick your finger way inside your throat, no, I'm not asking you to do that, but we know that inside there's going to be all the mechanisms for us to make sound. So we first identify this lower fold called the true vocal fold that has the vocal ligament within it. Above it is a false vocal cord, or the vestibular fold. It's these vestibular folds that are going to close together to close off the glottis. And then the epiglottis is going to come down and create a little structure for all the stuff coming from the oral cavity to be bathed off to the side into these little valleys called the valleculae going around it and then down into the esophagus. So we take a look at the true vocal cord, and we follow it posteriorly, and we see that arytenoid cartilage with a muscle there, the arytenoideus, and then this little cartilage sitting on top of the arytenoid, being the top of your thumb, would be the corniculate cartilage. And then there's one other cartilage just kind of forms this C shape or comma shape, the cuneiform cartilage. So a lot of cartilage, a lot of musculature, a lot of mucosa, epithelium and glands, very complex structure in this area. So here now we see the actual cadaveric specimen. Can anybody tell me if this is a posterior view or an anterior view? It is a posterior view. All right. Yeah, it's got to be. Because you don't see the thyroid eminence in this area, laryngeal eminence. Yeah. So here's the, and what threw me off is I said that the, as you recall, that the epiglottis was posterior, but it's posterior to the hyoid bone, but it's anterior to this whole structure. So it's the hyoid bone, the body of the hyoid bone would be right in front of the epiglottis here, and then it will be in a position to be pulled down posteriorly and cover up this area, creating little valleys so that it could be pushed back in this direction. So what we see over here on the right and on the left are the cut-free margins of the pharynx, the smooth muscular, it'd be skeletal muscle here, skeletal muscular wall of the posterior wall of the pharynx. And then this would continue down, and the esophagus would be down here, posterior to the larynx. So we're looking from the posterior view, so we see this large portion of the cricoid cartilage posteriorly. So the cricoid cartilage is large in the posterior part, and then in the anterior part that we were palpating is the more narrow part of it. So it kind of looks like a class ring in that sense. Big on the posterior part. And on that posterior part is where the muscle is attached, and then we see up above the cricoid cartilage, the corniculate cartilage, that was that comma-shaped cartilage, and then there are the mucosal and muscular connections to the epiglottis. So what would this structure be up here at the tip of the arrow? Be the tongue, right? So if this was the view looking down into the floor of the pharynx, when we're looking at the pouches and the arches, we would see the tongue buds up here, and then that branchio, what was the term for it? I'll have to see it again, I can't remember it. There was that eminence in front of it, hypobranchial eminence, there it is, that differentiates, as we will see, into this cartilage and the very base of the tongue. Some other structures I want to point out just to reinforce that idea. The somatic mesoderm, not the somatic, why do I keep saying that? The splanchnic mesoderm and the mesenchyme of the pouches, of the arches in this area differentiate into many things: musculature, cartilage, all of the connective tissue, all of the vasculature. So there's branches from the arteries coming into this area. And then the neural crest cells that have come into this area will have differentiated into the nervous tissue as well. So the sensory fibers in these, you can see all these branches of nerves coming in as sensory, and as well they are innervating the musculature. So all of these nerves are neural crest origin, but the axons in here that are innervating these muscles originated from where? The neural tube, right? So any axon of a motor neuron that we find out here, of a somatic motor neuron, is going to be of neural tube origin. So the laryngeal cartilage is developed from blank, that is derived from blank. So obviously, as I was just saying, it's all the mesenchyme from the neural crest cells is what we are considering for the development of all those cartilages that we had talked about. So there's the splanchnic mesoderm and the mesenchyme from the arches that are contributing to these developing structures. So we'll end here on the discussion of the larynx with letter E, and pick up there with the taped portion that will be on the website. So there shouldn't be any problem jumping right to the lecture 20, because this lecture that we're covering really just completes the discussion of the development of this specialized area and the epithelial lining of the trachea. So we saw the laryngotracheal tube divide into the bronchial buds and leave behind the single trachea, and that's what the trachea is what we complete with our discussion here. And then the lecture on Friday, lecture 20, will pick up at those bronchial buds and show how it invades the chest area, the primordial chest area, and develops into the ornate structures, the lungs. So it's a little bit challenging because it keeps dividing and dividing and dividing and dividing, getting ever smaller and thinner until we have the alveoli. So we're not going to expect you, or Marco, there you go, calling you Marcus again, Marco, to know all of the anatomy of that, all the different lobules and everything. But we will appreciate the ornate structure to get down into those millions and millions of alveoli. So I appreciate your time and attention. I'll be thinking of you as I'm in San Diego looking over the Pacific Ocean. Attending the meeting and having a nice lunch and maybe a cocktail and saying, have a good time. No, actually, I'll be flying on an airplane when you guys are in here. So I'll save lecture 20 onto my documents for you here. Okay. Or did you put it there already?
I was just running off the web.
Usually behaves a little bit better straight from here, and then there's no risk. So
Right.
I'll just drop it right on there. So it's now in my folders.